Now, for more reaction to that story, we're joined by menstrual health activist Candice Chirwa. Candice, good to have you on the program this evening. So, firstly, let's start with the basics. The study detected endocrine-disrupting chemicals in some sanitary pads. From a menstrual health perspective, how significant is this finding?
Thank you for having me. I think when I was listening to the briefing this morning, it does provide a lot of clarity that the study confirms that there are chemicals in these period products. However, it doesn't really confirm the causality as to whether it causes reproductive toxicity, hormonal imbalance, or may potentially cause cancer. And I think there needs to be more investment in research to ensure that we can see this causality. So it was important that this briefing did provide no panic for a lot of menstruators, but I do think that we should be moving towards zero risk in these menstrual products purely because of where these menstrual products sit. They sit at a very sensitive part of the body. And so it cannot be that we are being told that EDCs are present everywhere and including in menstrual products, and we shouldn't have them in menstrual products at all. So I think it was a vital and important press briefing, but I think as menstrual health activists, we've been reflecting on the need for more robust and transparent conversations in this space. Yeah.
So we've heard from the Health Minister, Dr Aaron Motsoaledi. He says there's no evidence of clinical harm and that people shouldn't panic. Do you think that reassurance strikes the right balance at this moment?
I must admit, when I heard the comparison that he made with men being exposed to these EDCs as well because they can wear PPE in occupational work, I think what's really important to realize is that we have to use these menstrual products as a form of dignity to manage a biological function, whereas PPE is used in environments where you have the option within a career choice. So having that sort of like comparison for me didn't really land perfectly for me, and I think a lot of menstrual activists were pretty offended at that statement. But I think what he was trying to provide clarity is that there are these EDCs in everything that we use, whether it's cosmetics, whether it's in household items. We just need to be aware of it. But I think with menstrual health products, as I mentioned earlier, because of where it sits in the body, a very sensitive part of the body, there is a membrane that absorbs these chemicals that goes directly into your bloodstream. And so it cannot be that if a young girl who starts her period at the age of 8 and stops menstruating at 45 is exposed to these chemicals, that it should just be business as usual. So I think we should be opting for zero risk in these period products. And I feel that we need to be having the period product companies finding alternatives so that we are not worried about health risks when it comes to women's health. Yeah.
So you've said that you feel conflicted about the response because while the study didn't prove causation, it still confirmed chemicals are present. Why is that nuance so important in this discussion?
Well, although it says 6.8% of the chemicals were present in these period products, we need to think about, like I said, the duration of how long we're wearing these period products for. The average age that a girl starts her period is 13, but young girls are starting their period as early as 8. So if a girl is exposed to these chemicals for an average of 30, 40 years, and it could potentially be causing irregular periods, could potentially causing hormonal imbalances, we need studies that actually verify this and can confirm this. So I'm at least appreciative of the fact that there's a willingness to collaborate with researchers and not completely shutting down the incredible work that the UFS team did. But I do think that it is important that we realize the significance of these products, that it is, again, designed to absorb menstrual blood as a way to manage a biological function, but it shouldn't just be completely sidelined as a thing that because there's minimal risk, therefore everything is okay. I think that's, for me, the contradictory nature of the statement, in that we are aware that the chemicals are existing, but we're also saying let's just continue as everything is fine. That, for me, is causing a form of concern and a little bit of anxiety, and I think we just need to be having more transparent conversations. And like that student said in the clip, let's put transparency on these boxes, on these pads, so we know what the ingredients are. Just like when you know what the food that you're consuming, the ingredients that are in there, we need to also have that for menstrual products too.
Yeah. So one argument from officials is that these chemicals exist in many everyday products, from cosmetics to food packaging. Do you think that explanation risks downplaying concerns about menstrual health specifically?
It definitely downplays it because these are hormone disruptors. The menstrual cycle is governed by hormones. And so if we are being exposed to these hormone disruptors, it can potentially cause multiple symptoms. And I think that's why we need more studies, more research to confirm this. The menstrual cycle is a very sensitive part of our bodies. We can experience multiple symptoms during our luteal phase. We can experience multiple symptoms during our period. And so if we find that the period products could be also disrupting that part of our menstrual cycle, it's super important that we are mindful of this. I think if we know that EDCs exist when it comes to cosmetics, that's totally different to your menstrual cycle, which is a sensitive part of your body. It impacts your productivity. It impacts your ability to concentrate, your ability to navigate social activities in terms of period pain. And I think it's really important that we understand how the menstrual cycle is governed there. And I think we need that expert learning those insights as well. And I think for me, that's why I was a little bit contradicted by that briefing because it just felt like there was a little bit of a disconnect in understanding that it can disrupt our hormones. So that's, I think, a very crucial part that's missing there. I do have to applaud the fact that DBE is willing to take an initiative to provide education to a lot of girl learners, but menstrual education is fundamental in understanding the menstrual cycle. And if these EDCs are disrupting that, then we need to be very mindful of how that can play in our daily lives.
The statement from government also came on International Women's Day. From your perspective as an activist as well, did that moment require a stronger message about women's health and also issues around accountability?
I truly felt that it was necessary to have this conversation on International Women's Day. I think there has been a lot of concerns about the silence from the necessary parties. So it was very important and crucial that there was a conversation about it. I just think that the tone in which comparing EDCs in different elements compared to menstrual cycles or menstrual health wasn't necessarily received well, especially as the Menstrual Health Coalition. We were busy just reflecting on the press briefing, and we felt that, again, women's health is being neglected and it's just being pushed to the side and treated as business as usual. So I think for me, it was necessary to have this conversation, but I think it sparked a necessary reflection that if we need to be intentional about bringing about menstrual justice and dignity, we have to be very just aware of the messaging and how we come across when we're speaking about the menstrual cycle and not basically comparing it to something else. I think a lot of young menstruators were seeking clarity to know that they can continue to use these period products, but also realizing that there's going to be further investment to ensure that there's transparency so that they do feel safe. So I'm just hoping that from this, it's not just going to remain silent, that hopefully government can collaborate with menstrual health experts, menstrual health educators and activists to really ensure that the message is well received and that it's not just going to be sidelined and that we're going to be silenced as usual.
Yeah. You've also raised concerns that the briefing didn't clearly outline next steps. What would meaningful action then look like for you in terms of regulation or oversight of period products?
Yes, I think it was important to note that these products are not going to be recalled, which I think is very important because people do require these products on a monthly basis. I do think, though, that it is important that we bring the period product manufacturers to account for what the next steps would be. I think there needs to be a collaborative effort with researchers, with academics, especially the women's health space that can invest money and research into ensuring that we do have tangible studies that can confirm that these period products are safe to use. I do think that it is important that the messaging is empowering and not just, again, meant to silence us and just say business as usual. Because although it is a retail product that you can find in the stores, this is a menstrual health product that can have an impact on your woman's health. So it is super crucial that we don't let this message remain quiet, that we are at least least in letting people realize that we don't menstruate once a year, we menstruate every single month, and that young girls in particular require the necessary empowerment and education to feel not only realizing that this is a normal thing,
Right.
but that they feel comfortable enough to know that this period product is not going to interrupt their woman's health. Yeah.
So regulators like SAPRA currently classify sanitary products as low-risk medical devices. Do you think that classification should be revisited given this new research that we see?
I definitely think so. I think there needs to be more studies put into the causation, because we've at least noted that there is chemicals present. And I think they must perhaps think about alternatives to disposable pads or disposable panty liners where there is no chemicals. I think there needs to be innovative ways in which we can find period products that can be distributed to the market that are safe, that are also accessible and also not too expensive. Because I think a lot of the conversations that menstruators have been having is that alternative products are a bit costly. And in the context of period poverty, what period products can you turn to? So I think this really calls for finding alternatives that are affordable and safe, but also ensuring that there's no chemicals present. I think for me, the goal is to say, let's move from minimal risk to zero risk, and that these period product manufacturers can find alternatives and innovative ways to deal with that. Yeah.
Candice, another issue here is transparency. Should manufacturers then be required to clearly disclose the chemicals which are used in these menstrual products?
100%. As I mentioned earlier, whenever we know what we're buying, any product, retail product, you'll always see at the back of the box or the back of the packaging the ingredients that are listed there. I think the same must be done for period products. And it was really interesting to note that when I was on Newzroom Afrika 3 weeks ago with Prof. Lizette Erasmus, she was saying that, sometimes these manufacturers wouldn't know if it was intentional that these chemicals lay at the top, but they also are not entirely sure to note which chemicals are there. So I think it's important that these period product manufacturers are being very transparent to tell us what exactly, layer by layer, material by material, is going into these period products, so that we as a consumer can opt into buying into these products. You're giving us the agency to decide whether we want to have these period products or not. So I think it is a catch-22 because, like I mentioned, it is a biological function. We require these products as a necessity, but I think we do have the right to be able to be empowered to know what we're purchasing, and it can start off with having those ingredients at the back of the period products.
Candice, let me thank you so much for that insightful chat. That's Candice Chirwa, menstrual health activist, speaking to us this evening. And this debate does highlight the balance between scientific evidence, consumer safety, and women's health advocacy as well.